The conclusions that came out were striking. The evidence was sufficient to demonstrate that smoking by cancer patients and survivors caused adverse outcomes. It specifically increased overall mortality and cancer-related mortality. It increased the risk of getting a second primary cancer, and there were very strong associations between smoking and cancer treatment toxicity. The magnitude of these effects was substantial. If you take a look here, this is actually kind of a summary of the median effects of smoking, positive and negative studies across all cancer disease sites and treatments. With regards to overall mortality, current smoking increased the risk across disease sites and treatments by about 51%. Cancer-related mortality, 61%. And you can see former smoking, quitting smoking in the past, those risks were substantially reduced or non-significant whatsoever. So current smoking was strongly associated with adverse outcomes. And you might think to yourself, well, this is a head, neck, or a lung cancer problem. Well, if you go through and you try and actually identify the studies that have looked across a spectrum of cancers, this actually is a bar graph to kind of give you an idea based on, and the red actually shows, hopefully those of you who are red-green colorblind, the ones on the left. The red bars indicate the number of studies that showed significant negative associations between tobacco use and at least one outcome, survival, toxicity, recurrence, whatever it may be. You can see across head, neck, lung, breast, prostate, hematologic, GU, GI. This isn't a head, neck, and lung cancer problem. This is a cancer problem. The effects are true across disease sites and treatments, and so you can really use this as a way to try and address a variable that's important within reason pretty much across cancer as a whole.